2, 1. All right, summer is here, and you've heard Surprise talking about Tinder and Hinge on the past videos. So, you might be getting back into the market. And today we'll be talking to a whole bunch of you, or some newly divorced, or, you know, just maybe starting to get serious with your boyfriend or girlfriend. Today we'll be talking about STIs. All right, and there's so much to talk about. We might even split it into different parts, you know? So let's get straight to it. My name's Craig.
My name is Surprise, and
Cool.
today we'll be talking about sex.
Yes.
Can you shut up?
Such a weird thing to talk about, right? We feel probably it's not something we talk about a lot with our patients. So even talking to the camera is a little bit weird. So it might even be harder for you when you have to talk to a real person in life who you're going to get engaged with. But let's start with syphilis. The Sif man. All right. So when it hits you, you would think, oh my gosh, I have syphilis. No, you wouldn't know. It comes painlessly. There will be a sign, but it's painless. It might just start off as a little ulcer on your mouth. We call it the chancre,
Shankar.
right? It comes from the French word, is it chancre, not shagging, all right? So it's painless and it doesn't last that long. It could be like 3 to 6 weeks and it's all cleared up. All right. But it doesn't mean it's healed. It's still acting right there underground. So it's best you just pay attention to it. If you have like a little ulcer, it lasts for more than 2 weeks. It's not like we spoke about signs of stress at some point, and you can get those. But sometimes, if it lasts too long, might be worth looking into.
And this is the interesting part, and this is where knowing what you've been up to is very because that's useful. Because if you have not engaged in oral sex with someone and you do it for the first time and you develop something strange, keep an eye out on it. Just keep an eye out on it because it could be an STD, and also, yeah, I think it's mostly with new partners,
Yeah, mostly, but
Most.
you know,
But it can happen to
temptation exists. The partner you've known and loved for so long is still just human.
Indeed.
And, they might have met a baddie or a hunk or a chad that could have just, gotten their knees weak for like just a brief moment, and they could say something like, but we didn't go all the way. But, sometimes half of the way is enough to bring it back home. So you just be cautious about that. But on the plus side, people don't die as much from syphilis. The only people who do are people in denial and people, well, I would say people living in the desert, but they're probably not getting lucky because we have antibiotics. Penicillin, it's not even that fancy. The same stuff we give here for oral abscess will cure you of the Sif.
That's an interesting one. The other one that we talked about was herpes. But this one, I mean, everybody has herpes, like we said, you get herpes mostly as a baby, when your parents kiss you, your aunt kisses you, then you have a herpes sore, right? If you are wondering what to do, you can buy like a small gel. I think it's over the counter, a cyclover. A cyclover.
We on a prescription for a cyclover?
I don't know. I think you can buy it over the counter. I'm not sure.
I
But
don't
anyway,
remember. Yeah.
if you have that and it's worrying you or you've got a photo shoot, the key thing is to make sure when it's still like crusty, because once it passes that part, right,
Yeah.
then you're just going to have to see it through. So, no, not once it's crusted, once it's still a little blister.
Once it's a little blister.
Once it crusts, it's over. Then you just have to see it through. So, yeah.
So that's basically just minimizing how long you can have it for. When the first time you get it, it might be like for 7 to 14 days, but like afterwards, because it recurs, this one is not like the SIF. This one is here to stay. It's a permanent residence. It can't be cured. It's just a part of you. And the best thing is to just accept it and find ways to live with it.
You can get a T-shirt. I've got herpes.
Yeah.
I'm joking. But it lives like in your nervous system. So there's no way around it, right? And it won't kill you. It won't kill you. So if you have herpes, do not fret. Do you know any other STD worth mentioning?
Yes, gonorrhea. Gonorrhea. How could we go without that? And here, this one is, I'd say, even worse than the SIF because it usually doesn't come with any symptoms at all. There will be some, but it will be mostly around your throat. Or most activities might not be visible around there, but you might have, a sore throat. So you had some
good times.
Good times. Good Lord, it's so hard picking it.
You had some good times.
Yeah, and you are the throat goat, and now you are staring just a little something there with a sore throat. Again, and the symptoms might disappear after that, but there are levels to it. It has to be treated with antibiotics as well,
And you've heard about this whole new super gonorrhea thing.
No.
Oh, yeah. It's gonorrhea, which is resistant to antibiotics.
Yes.
Yeah.
So you gotta make sure that when you are diagnosed, you finish your course.
Yeah.
Okay, and your partner should finish the course, and hopefully you don't catch gonorrhea in the hospital.
And here's the interesting one about gonorrhea, right? I might have gonorrhea, right? And I have a beautiful lady engaged in fellatio, and she gets gonorrhea and exhibits symptoms, and then she'll be like, oh, you can be a carrier for gonorrhea without even knowing about it, right? So if, for example, this is my pretty lady with gonorrhea, I would also have to take antibiotics as well, so I can be clear and she can be clear. So you can be a carrier for some STDs without you even knowing about it. So somebody could look great, you do your thing, you saw nothing, you just look great, and next thing's like, what's going on? It does happen. It does happen.
So you gotta stop the eye test. Like, we're not like, I think, nah, you clean. There's no such thing, okay? Like you need tests for all of these things that we mentioned. If you suspect that you could have it because of your lifestyle, because of something that you did. And lifestyle makes it sound like you do this every weekend. Because of something that you did, all right? You just gotta just be cautious of it. Okay, you were an eater 2 weeks ago, and now you gotta eat some antibiotics, and you just have to do that. But we can't talk about how to spot them and identify them and how to treat them without talking about how to prevent them. All right, all right. Tinder, first date, great. The drinks are good, conversation is flowing, the partner is attractive, but they do have a little some there. Don't assume it's syphilis. Don't assume it's herpes, all right? But also, don't rule it out. Ideally, delay the first kiss, okay? Because most of these are especially contagious, especially herpes. It's especially contagious when the ulceration is visible. And it's okay to have an uncomfortable talk. It's better to have the uncomfortable talk than having to, go through all of that stress. Lab results are expensive, okay? Pretty, really expensive. I mean, a kiss is not worth about $3,000, but that's what that test might cost you. Add antibiotics on top of that, and the emotional turmoil and the trauma of, I'm not going back to online dating. It doesn't even have to be online dating. You could get it anyway.
Got an STD. That's not a conversation you want to have.
Exactly. And when you do find out, do let your partner partners know. It's not about shame. It's not about guilt. It's about protecting others, you know?
And on the topic of partners, if you double with many partners, I mean, that's nice, that's
Yeah.
great. But like, also be transparent that you do. I would recommend, so that if you get something, they know that it's from your lifestyle, you know. So I think being open with your partners about what sexual activities you guys conduct is very important, so that if an STD does spread in this whole chain, it can be caught early, and all the people affected can also get relevant treatment as well.
Exactly. And just be wary of anyone who's on some, oh, I don't like condoms. I don't like, they're there for a reason, and they don't have to be boring. Okay, there are some is it polyurethane condoms, very thin, damn near skin to skin, and you don't have it doesn't heat distribution is fine.
Damn near skin to skin. Wow, you should be a salesperson.
You know?
Whoa! Wow.
Yeah.
Okay.
So make sure you choose the right type of condoms, especially for people who might be sensitive to them. And you can avoid the latex and the rubbery smell, because some people can be allergic. And you must get used to using lube. All right? It does seem like extra admin, but it does make the whole process much more enjoyable. All right? Just use it.
Yeah, and
Communicate it.
be careful with engaging in oral sex, actually. That's another one. I'd say vet people. Yeah, like you should be, vet your oral sex partners, because
You trust people's judgment. That's like another eye test.
like there should be some communication or something, because unless you want to engage in oral sex with like a condom, which is possible, you can.
Or a dental dam.
Or dental dam. So if you would like it, you're that fellatio goat. Fellatio, that's what they call it.
Yeah.
Yeah.
You avoiding to say throat goat. Or your favorite eater. Like, how did you learn? How often are you doing this? But you just gotta be wary about that. And also for the people who think I don't like condoms, as the people who do put it on, maybe get your right size. All right. Everyone's different. Find your fit. And it will make it a much more enjoyable experience for you. There's also some glow in the dark, all right? And also, finally, to wrap it up, in the early stages, with the lights on, you wanna see where you're going, all right?
And another one, this is the big one. See a professional. That's why it's important to see your doctor, your dentist, and be honest. Like, don't lie. Don't say, I just bit myself. Because we can see. Like, tell us, like, hey, man, this is what happened. I went on Tinder, and this is this, and this happened, because it helps us in determining history and saying, okay, this is probably an STD, or ruling out an STD in that case. So also be honest to your healthcare professionals whenever you encounter something strange, especially after intimate moments.
Get tested. And there's no, it could be 3 weeks, 3 months, 3 years. There is no right time to start like going in raw dogging. Is that the word they're using?
That's the word they're using.
Yeah, there's no time frame. All right. Like I said, temptation exists for everyone. So just make sure that if you are going in for exclusive relationship, get tested before you rule those precautions out. Stay safe so you can enjoy summer with a good budget and a good health.
Cheers, cheers.